Hi, my name is Lisa Walker. I'm a registered nurse and I'm a certified registered nurse in fusion. That's my specialty. Today I want to talk about a little bit about MS, multiple sclerosis, and one of the best treatments right now, Tysabri. Now, multiple sclerosis can sound very scary when we hear that, and 30 years ago it was very scary. Now, it really is not that bad. Not to say that it's not a significant illness, but it is something that can be managed. Okay, multiple sclerosis is where it's an autoimmune disease, and that's where the body attacks what is called the myelin on the nerves. Myelin coating our nerves, you can think of an electrical cord or your charger, your charging cords. And when the cord gets a little old and it bends this way and it doesn't work, you have to hold it this way and then it suddenly works. That's where there's breaks in that insulation on the outside of that electric cord. That allows shorts to happen. Now, in the human body, when these shorts happen, nerve transmission gets broken up. In MS, depending where those breaks are, will display as the symptoms every patient will have. Now, between patient A and patient B, the symptoms may be completely different. Some people may have tingling in one hand. Some people may have a little bit of droopiness in an eyelid, tingling in one side of their face. You can have problems with bladder control, bowel control. You can have being very tired, exhaustion. You can have periods of brain fog. You can even have problems with your vision where when the optic nerve is what has that little short in it, it can cause a difficulty with your vision. These things are all caused by that disruption in the myelin. Now, how do we know you have MS? Your doctor will do several blood tests. They will do, the most important is an MRI of the brain and the spine. They may do a spinal tap, looking for abnormal protein levels. And then when they have a high suspicion, they will do a blood test for something called the JCV virus. That is for the John Cunningham virus. That's important for us to know as clinicians because when patients have been exposed to this, and many of us have been exposed and didn't even know it, once we're on medications to treat the MS, there is the potential of developing what is called PML, progressive multifocal leukoencephalopathy. It's basically a viral infection in the brain, and we need to be aware of that because this infection, if not caught early, can be fatal. It is very rare, and that is why we monitor this JCV level every 6 months. Now, just because somebody has a positive JCV does not mean they cannot continue with their treatment. We just expand the time between their treatments. And you will also have a repeat MRI every year, looking to see if there's any new of these shorts forming, because they're seen on the MRI and they glow bright white. Okay? The most common type of MS is called relapsing and remitting. So in other words, the patient will be going around, they will have certain baseline symptoms, something will trigger the immune system to go into overdrive again. They will have what's called a flare. They may get extra symptoms, their symptoms may worsen, they'll get treated. We may treat them with a dose of steroids for a day or two, and then they come back down to their baseline with no further permanent damage. That's the most common type. Now, one of the beautiful things is with all these tests, patients are being diagnosed much, much younger. So we don't have to wait until a patient has a lot of disability before multiple sclerosis is finally the diagnosis. And that was what used to cause a lot of problems for people, was the time that it took to be diagnosed. Now, when a patient is diagnosed, we can start them on medication called Tysabri. Tysabri is given every 4 weeks through an IV in your arm, relatively comfortable, Takes about an hour. You stay for monitoring for another hour afterwards, because if you're going to have any adverse effect or adverse reaction to the medication, we would much rather it happen when you're with us and we can treat you and not have to send you to an emergency room. Our goal is to make this at least impactful on your life. Tysabri works by helping calm down the immune system a little bit so the immune system stops attacking that myelin. So it stops attacking the insulation on the nerves. This helps prevent further damage. It's important for people to realize damage that has occurred cannot be fixed. That damage, unfortunately, will be there. Our goal is to prevent further damage. So the benefit of this is by us basically calming down an overactive immune system that is recognizing the lining of your nerves as something other than yourself and is attacking it, we can help prevent further disability, further numbness, muscle weakness, trouble swallowing, nausea, bowel problems, bladder problems, and people can maintain their quality of life. I have patients who travel all over the world who've been on Tysabri for years, and they live their best life. And that's the whole point of the medication.